All right, welcome to this explainer. If you're getting ready for your MBBS finals, this is exactly what you need. We're going to break down the essentials of antenatal care into a clear, high-yield pathway. Think of this as your guide to supporting a healthy pregnancy and, just as importantly, spotting complications before they become big problems.
So let's start with the absolute core principle. Everything we're about to talk about, every test, every measurement, every single conversation, it all boils down to this one simple goal: making sure we get the best, healthiest outcome for both the mother and her baby.
So, where does this whole journey begin? It starts with one single, incredibly important appointment, the booking visit. This is our ground zero. It's where we lay the entire foundation for the pregnancy, figuring out what's normal and what might need a closer look. Think of this visit as a major data gathering mission. We're looking at 4 key areas. And it's not just about ticking boxes, right? Each one of these gives us a crucial piece of the puzzle, helping us build a really comprehensive health picture from day one. Okay, so first up, BMI. Right off the bat, this simple measurement helps us start stratifying risk. If the BMI is on the lower side, under 20, we're already thinking about the baby potentially being smaller. And if it's over 30, our antennas are up for things like gestational diabetes and high blood pressure.
Now, urine testing is a great example of how our focus shifts. At that first booking visit, we're not just dipsticking. We're sending a proper midstream sample to the lab. We're hunting for silent infections that could cause serious kidney problems later. Then, at all the follow-up visits, the dipstick becomes our surveillance tool, keeping an eye out for protein and glucose, which are clues for preeclampsia and diabetes.
And I love this quote because it really drills home just how critical this is. Getting an accurate baseline blood pressure is, without a doubt, one of the most useful things we do. It tells us if there's any underlying hypertension and gives us that vital reference point for the whole pregnancy.
Okay, let's talk bloods. This table gives you the high-yield tests we do at booking. And these aren't just random. Each one is targeting a specific condition that we can either prevent or manage. Let's dig into a couple of the really key ones.
So, when you look at a full blood count, don't just stop at the hemoglobin level. The mean cell volume, the MCV, is your next best clue. It points you to the cause of the anemia. If it's low, you're probably looking at iron deficiency. If it's high, you should be thinking more along the lines of folate or B12 deficiency.
Now, checking the rhesus D status is all about playing the long game. It's pure preventative medicine. By identifying rhesus-negative women early, we can give them anti-D at the right times to stop their immune system from creating antibodies that could be a problem in future pregnancies.
All right, so we've got our baseline history, our exams, our bloods. Now it's time to actually take a look. We're moving on to ultrasound, which gives us this incredible, direct window into how the baby is doing.
A really key point for exams: not all ultrasounds are the same. The early scan, the dating scan, is about the fundamentals. Is the pregnancy viable? How many babies are in there? And exactly what's the due date? The anomaly scan, which happens later, is a totally different beast. It's a detailed, head-to-toe check of the baby's anatomy.
And you know, when it comes to dating, timing is everything. In that first trimester, the crown rump length is the gold standard. It's incredibly accurate. After that, we switch to using the head circumference. This is why getting that early scan is so important, because after 20 weeks, babies start growing at their own pace, and it gets much harder to nail down a precise due date. So what are we actually looking at in this image? This is the nuchal translucency measurement. It's that tiny collection of fluid at the back of the baby's neck. And this measurement is a really key part of the combined screening for Down syndrome, along with a blood test from the mother.
Okay, so we've gathered all this information from the history, the exam, the bloods, the scans. Now what? Well, this is where it all comes together. We use all that data to figure out who might need a little extra attention, more specialized care, or closer monitoring.
Let's talk about preeclampsia, because this is one of the big ones we are always on the lookout for. If a woman has any of these risk factors in her history, that's an immediate trigger for us. It means more frequent checks and often starting preventative treatment like low-dose aspirin.
And it's a very similar story for fetal growth restriction, or FGR. Seeing these factors in the history immediately raises a red flag. For example, if it's a twin pregnancy, or there's a history of a small baby before, we're definitely going to be scheduling regular growth scans to keep a close eye on things.
Let's zero in on one of the most common conditions we screen for, which is often flagged by those risk factors we just talked about, like a high BMI. And that is gestational diabetes mellitus, or GDM.
Now this right here is pure exam gold. Remember these numbers. The diagnosis of GDM isn't vague.
It comes down to very specific thresholds on the oral glucose tolerance test, and you only need to hit one of them, either the fasting number or the 2-hour number, to get the diagnosis. So once GDM is diagnosed, what's the plan? Well, the management is actually really logical and follows a clear step-by-step process. We always start with education, diet, and lifestyle changes. We only move on to medications like metformin or insulin if those blood sugar targets aren't being met.
And why do we go to all this trouble? What's the point?
Well,
because it works. It's been proven that treating GDM makes a huge difference. It directly reduces the chance of the baby being born very large, which in turn cuts down the risk of serious complications during delivery. It's a perfect example of an intervention that leads to better outcomes.
So when you take a step back and look at the whole picture, antenatal care is really a masterclass in preventative medicine. It's about taking these seemingly simple, routine checks, a weight, a blood pressure, a urine sample, and weaving them together into a powerful system that can predict and prevent problems. It's all about being proactive, not reactive, to give every pregnancy the best possible start.